lot of different systems of explanation out there to understand parts. Theory of structural dissociation is a very popular one. IFS, internal family systems, is one that many people in the EMDR community resonate with. So it's always a bit of a hard question for me to answer technically, because when I talk about parts, it's just so organic for me, because I have these 5 different parts that have been a big part of my experience really throughout my adult life. I refer to them, because they're all Jamie, but I refer to them as like me at different ages, like 4, 9, 19. And so for me, it's just always been very intuitive and organic to understand that a person is really a collection of their parts, no matter whether they're defining them by age, by emotional state, if maybe they've named them, maybe they have names by the different traits and qualities they represent. So I think if you understand you're working with somebody who has clinically significant dissociation, or maybe somebody who does not kind of ring the bell as having a clinically significant dissociative disorder, but they resonate with this language of parts, that a factor in phase 2 preparation needs to be coming up with some kind of a metaphor for understanding the person's internal system. I know a lot of people in the EMDR community use Fraser's table, which is fine. I mean, it's good, it's solid. And many people who I serve like that idea of having their parts gather around a conference table, or sometimes when I deal with clients where we're dealing with just 2 parts, like a younger child and their adult self, sitting down at a table for tea can certainly be a nice one. But the metaphor I've often used to describe my own parts is a van. That adult Jamie, especially because I don't have time blocking symptoms, or DID's never really been a part. I've never fully qualified for that, but I'm close. Adult Jamie is driving the van. But my different parts are occupying different passenger seats. And so at times when I am in the highest distress, or at times over the years where I've really needed to seek out EMDR or other treatment again, it's like my 4-year-old part or my 9-year-old part is sitting in the front seat with me trying to grab the wheel. And sometimes my distress can be so high that it can feels like one of the other parts gets behind me in the driver's seat and they're putting their hands over my eyes. And so although I have always, as my adult or presenting self, been in control, there are times that if there's unhealing or unrest in the system, it can be really darn hard to drive that van. And when I notice that starts to happen, metaphorically speaking, it's like which one of the parts here is trying to scream out. And so if you've ever traveled with a child before, the whole, are we there yet? That's a lot of what the parts world is like for me inside. So other metaphors can work. I've had people before use the dollhouse as a metaphor, that different parts occupy different rooms of the dollhouse. That I've had clients use sheath of balloons before as a metaphor, that different balloons occupy a different part. And then movie figures work great for this. I also kind of have sometimes used the Wizard of Oz as a metaphor for my different parts as well, that Dorothy is me, but my other parts are like Toto and the Scarecrow and Tin Man and Glinda the Good Witch, or Elphaba if you like Wicked, and Dorothy needs all of them to get home, so to speak. So I think having an understanding of how a person's system works, and this is where, if as I'm saying this, you're getting nervous, get some consultation from somebody who has an understanding working with dissociation. Because even as somebody who has been treated for this condition, when I first really deepened my EMDR study, I found the consultation element very helpful to talk me through these first couple cases of getting to understand a client's internal gallery of parts and how they may interact with each other. And then part of understanding how the system works is understanding like which parts may be most likely to fight with each other, which parts may be in most support. And also realize that when you take a history, different parts may have different perceptions of memories that happened. So I think an imperative here is in working with EMDR is you are speaking, or in any trauma therapy, is you are speaking to the presenting client. You're speaking to the adult at all times. So what I mean by that is you don't want to say, let me talk to the 4-year-old and bring on the baby voice to talk to the 4-year-old. But what you might say to your adult presenting client is, does your 4-year-old part have some input here? And so you really are enlisting the adult presenting client as the translator for all the different parts when you're in a session. So when I do EMDR reprocessing with a client, I am speaking to the adult, but I recognize that one of the other parts may be taking over. Is sometimes not the best way to look at it. In DID, that's sometimes the case, but in a lot of other presentations of dissociation, it could just be that another part is really throwing a bad tantrum and they will need more of the attention in a given moment. So some other safeguards that I take in working with clients who have the issues we're talking about here in this video is when you recognize that a block is happening or the flow of processing isn't going as well as it should be, you can use your knowledge of the parts to help you with interweave. So an interweave, a cognitive interweave I use a lot is, so does your 12-year-old part have something they're trying to say here? Does your 16-year-old part have something that they're trying to tell you about here? Or does that 3-year-old part have a different view of the memory? And then if you know some of the attachment-focused interweaves, that may help as well. So, I mean, there's really so much you can do that it's hard to really cover this very simply. But I inevitably find that once you get an understanding of parts and interactions and dynamics, that these things can be a lot easier to navigate. You may sometimes have the same memory, and even though you're working it with the presenting adult, the adult may have to process it, and then the adult may have to process it again on behalf of, let's say, the 3-year-old part. That's another scenario that sometimes comes up. Another technical strategy that I often use is, let's say you're doing a memory, whether it's the touchstone or some other memory, and you process through, and then you get down and the SUD's a 0. I often like to follow up with, so is the SUD 0 for all the parts? And you may get no, it's still about a 4 for the 9-year-old part. Let's go with that. Notice that it's a 4 for her. So that's often a good safeguard as well. I like to do that too when we get to the VOC. So is the VOC a 7 for everybody? Oh no, it's still a 1 for the 9-year-old part or whatever it may be. And at that point, you can make the judgment call to either go with that, or you may have to make the judgment call to process that memory on behalf of the 9-year-old, because there may be other things that need to be brought in, or there may be different facets of the memory that need to come up if that 9-year-old is still holding, the 9-year-old that lives inside of you is holding so much of the memory. And from a technical perspective, that's another terminology that I like to use quite a bit. Because I know a lot of people who follow my work are also fans of Laurel Parnell's attachment work, and some other people in EMDR who do attachment work. And I think the key is when you're using attachment style interweaves and saying things like, well, who can we bring in for the little girl? Or who can we bring in? It's important to distinguish that you're not bringing in that resource for the historical 9-year-old that lived 31 years ago. You're bringing that resource in for the 9-year-old that still lives inside of you. To me, a brilliant facet of the EMDR protocol has always been that language of now as you look back. And I think continuing to emphasize that in a very mindful way with your clients is imperative here. And it helps them to recognize that I am Jamie, an adult, in the here and now. But those parts can still live inside of me. And those parts may give me some insight as I look back. As I look back, those parts may really step forward as saying, no, this was not right. I need some healing here. So in working with dissociation, I also get a lot of questions around, well, what about some of the specialty protocols out there for pre-verbal trauma? Because they do exist, and some of them are quite good, but I think I answer the question like I do a lot of questions I get, which is if you know the standard protocol well, you know that adaptations and modifications may be necessary when you're dealing with situations that may throw you for a loop, like dissociation or like pre-verbal trauma. So I think the key for me has always been that language of image or worst part when you're starting in phase 3. Because yes, I've long identified that Shapiro is a pretty visual person, so she wants you to get an image. But I always learned in my training and even in my read of her books that if no image is available, you can use any other channel where there's activation. So I mean, this whole emphasis on the when there are no words protocol or some other protocols, to me, that's just a common sense modification on what Shapiro gives us permission to do in the first place. So if there is this kind of sense of, yeah, I know something's in my body, but I can't quite remember what happened, then I use the body sensation as the image or worst part. And that is just, to me, a very common sense approach when you're dealing with dissociation. And sometimes with dissociation and complex trauma, another modification that I take is, yes, we ask for image or worst part, but a criticism even outside of the EMDR community is that is too likely to flood people. That why do you want to go to the worst if a person's not ready to handle it? So if you're kind of on that borderline between, do they have enough phase 2 preparation in order to go into phase 3, I often modify that as, what part of the memory are you most willing to work on right now? And then we take that part that they're most willing to work on, take them through the standard, knowing that you may need to go back and ask once more about the worst in order to have a real complete resolution, past, present, and future of the memory. But to know that wherever you can engage some of the willingness at first, that may be enough to start with. The more you show your fear of dissociation, the more a client is going to pick up on it and not be able to trust themselves with it. Something I wish more people in our field would understand is how high functioning most of us are. Is how vital this has been to our survival. And if a professional freaks out or shows their fear in any way when we kind of dip our toes into talking about that, it's going to shut us down even more. One thing that was part of my personal experience, and it's been the experience of a lot of other clients I've dealt with, is there's often been a fear of disclosing dissociation because we're afraid of how others are going to react or how others are going to think. It's the thing that I've been most afraid to come out about. And I've shared this in other things I've written, that I'm out as a recovering addict, I'm out as a bisexual person, but this has been the scariest coming out, because there's so much misconception around what dissociation is, and that we're crazy and that we're harmful and all of this. And anytime I have worked with a provider who has normalized dissociative experience, it automatically creates that ease and comfort. And I've had many clients and many people I've trained over the years give me feedback like, I can't believe somebody's talking about dissociation so freely. I can't believe somebody's outing their own experience so freely. Because if more of us did this, then we may have a less fearful culture around working with dissociation, both in the therapeutic professions and in society at large.